Good afternoon, and thank you for joining the 2020 ASPPH virtual annual meeting session, Coffee with a Doctor, all your coronavirus questions answered. This session is brought to you by This is Public Health and presented with the National Society for High School Scholars. My name is Hala Madanat. I'm the director of the School of Public Health at San Diego State University, and it is my pleasure to moderate this session. As we all know, the emergence of the novel coronavirus has turned our world upside down. In the well-connected world we live in, there is a lot of information available, but it can be difficult to discern the legitimate information from bad information. Today, we're going to learn a little bit about the virus and get answers you can trust to the questions you have. It is my honor to introduce Dr. Jennifer Tudor. She's a board-certified family physician and serves as the Deputy Chief Medical Officer for the County of San Diego's Health and Human Services Agency. In this role, she actively supports access to quality and timely evidence care in the San Diego communities. She's passionate about improving health of underserved communities. She earned her BA from Yale University with a special divisional major focused on understanding people's views of themselves and their environment. She earned her MD at the University of Missouri-Columbia, where she published research on family violence with her mentors in the Division of Family and Community Medicine. She was awarded a health policy fellowship with the American Medical Students Association, later working as a program analyst in the Office of the Surgeon General. She completed her residency in the Family and Community Medicine in Minnesota and promptly moved to San Diego, where she initially served as the medical director of the Imperial Beach Community Clinic. She has been honored to care for 4-generation families while serving leadership roles at several additional community health centers in the San Diego County for more than a decade. Please join me in welcoming her today to this session. Before we launch forward, I wanted to tell you how to be able to ask questions.
Maybe you should do the asking.
Sorry, my computer is going cuckoo on me. So please, at the bottom, you will see a simple button for the Q&A at the bottom of your screen. So use it and type your question in that pop-up box, please. And we will answer those at the end. Dr. Tudor will start with an introduction, with a brief introduction, about 15 minutes about coronavirus, and then we will spend a lot of the time answering your questions. So thank you again for being with us. We appreciate your time, and I'm turning it over to you.
Hello, everyone. I am working on this keyboard here. We practiced it. There we go. We practiced it 5 minutes ago, and I got the hang of it. So hello, thank you so much for joining us. We're going to go through some objectives in a brief slideshow today, and then we're going to focus, as Hala said, in taking all of your questions. So I'm Jen Tudor. Thank you for joining us and already seeing some of the questions. I know that some of our challenges here with COVID-19 and this new coronavirus are that it's new. We don't know a lot about it, and everything is changing day by day. So what we're going to go through today is looking at some facts about how to prevent the spread of COVID-19 and what it's all, what it is, how it affects our body, and what those whole public health views are of it affecting our population, both locally, in our nation, and in the world. We're going to talk a little more about what social distancing is and why it's important, since that's so much in the media and a focus and a key public health intervention. And we're going to talk about flattening the curve and why that matters. So going on to the next slide, coronavirus is a new virus that was identified in an outbreak of respiratory illnesses first discovered in Wuhan, China. So what we mean by a new virus is there is a group of coronaviruses. Everyone's seen the little crowns around the virus on the EM microscope view, and that's why it's called coronavirus. However, most of those coronaviruses have been around for a while, and we're very familiar with them because they give us the common cold. There are different kinds of new coronaviruses that have evolved over the last almost 20 years that are called zoonotic viruses that start in animals. And as our population expands in the world and as we encroach on some animal habitats, we start getting some of those viruses in humans that normally had just been in people. So this is a virus similar to SARS and MERS that have started in animal populations and crossed over to affect humans. In March 11th, the World Health Organization announced that COVID-19, which is the disease, CO for corona, VI for virus, and D for disease. So COVID-19, so 2019 is when it was first detected and identified. That disease is now a pandemic, has been since March 11th, because it is having outbreaks and epidemics in multiple countries throughout the world. So the name of the virus that is causing COVID-19 is SARS-CoV-2. So SARS for the severe acute respiratory syndrome, CoV for the COVID virus 2. So we know that the first episode of SARS was from a virus SARS-CoV-1. That was in about 2003 from China. And now the name of this virus is SARS-CoV-2, and COVID-19 is the disease. So our understanding of that changes daily. Everything we know about that really expands day by day. And part of the challenge is, who do we listen to? What's the best news source and everything else? I will tell you in this presentation, I'm relying on two main sources. One is the CDC, and the second is for the statistics. Johns Hopkins University from the very beginning has a hotspot map of both the world and United States, and now by counties in the United States, that gives those statistics. So those are the two resources that I'm relying upon. And I think what's important is, one, pick a good resource and then follow it through time, so you know that that data collection is happening in a systematic way. You're counting apples and apples, not apples and oranges. So it's so much in the news, one, because it's new, and two, because it's affecting more than 3 million people in the world. So we have almost 3 million cases as of last night in the world. And so we are continuing to focus on that and learn about that. You can see the Johns Hopkins map here, the world map, the hotspot. And so on the total confirmed cases as of last night, we're 2,971,000+. United States is has the most number of confirmed cases. So these are the PCR tests that are positive in the world, and that's by quite a lot. And then you can look at the mortality by country. So these are all from Johns Hopkins. You can see the citation on the bottom, and we can look at the case fatality rate here, which varies by country. So you can see Germany is as low as 3.8%, but Belgium as high as 15%. And here in the United States, we're 5.7%. There are various things that can affect the case fatality rate, because it is the number of people who die as the numerator divided by the number of people with known disease. That's the denominator. So you can imagine that the more testing that occurs in a country, then that case fatality rate can be lower. But if we're only testing those people, for example, who end up in the hospital, then we know we're going to have a higher case fatality rate, just because we're not capturing all those people who have COVID-19 but have a very, very mild case and don't need to be hospitalized. So each county is a little bit different in the United States. Here in San Diego, where I live, about 23% of persons with COVID-19 end up in the hospital, and 8 to 9% of people with COVID-19 end up in the intensive care unit. So that's about 30+% of people who are hospitalized end up in the ICU. And we have a case fatality rate somewhere around 3%, 2 to 3%. So those numbers vary by the testing. It also varies by the population. So if you have an older population, if you have a more dense population, if you have more people with high blood pressure, diabetes, asthma, and different kind of risks, all of that affects the case fatality rate. So how is our outbreak growing? Well, in the United States, on Saturday, so this data is reported in Johns Hopkins for the day before, on Saturday we had more than 32,000 new cases identified in the United States and almost 2,000 people dying. So you can see by the graph below that in April we started that upward linear trend. Let's talk a little bit about the spread, and that's been huge questions, and that's been an area of research that we are learning day by day, and different studies are being published, and it's great that we have so much information in our peer-reviewed journals so that when information is published, we can compare to other studies, and it's almost been like a dialogue in those peer-reviewed journals, because there'll be an opinion, there'll be some publication of very small numbers, someone else will then publish, and we continue to learn, but in this incredibly rapid way. So the spread of COVID-19 is between person to person, and that is the most common spread, we think, and especially by coughing, sneezing, singing, talking. We give out this virus, if we have it in our body, in small respiratory droplets. There's also some aerosolized virus, which is in much smaller particles, but the respiratory droplets that contain the virus are heavy. They go out about 6 feet from our body, and then they drop. If your hand's in the way, they drop on your hand. If your desk is in the way, they drop on the desk, and they can drop on your clothes and so forth. So we recommend that people stay 6 feet away from each other just to prevent that area of respiratory droplets from landing on you. And we get infected with the virus if it is in our eyes, our nose, our mouth, and that's why we say the most important thing is to wash your hands. So if we have contact with items that have the virus on them and we wash our hands, we're okay. If we have contact with the virus on different surfaces and we rub our nose, we rub our eyes, we have our pizza and eat it, then we could get infected with the virus at that point. Lots of investigations ongoing, and especially around the aerosolized particles, how long they can live. And what we don't know yet is, just because there's virus on something and it can survive potentially even for a couple days, is that virus still infectious? Can we get the disease by touching a 2 or 3 day old virus and then rubbing our nose? That we don't know yet. So symptoms, also we're learning more and more about the most common symptoms. I've listed them in order, at least of the top 5 or 6. So fever is up to 80%, 80 to 90% of folks have a fever. A cough, often productive, meaning you're coughing up phlegm or sputum. Fatigue, of just being exhausted. Anorexia is the fancy word for not wanting to eat. And so some of that is a new loss of taste or smell. Some people describe eating food as if you're eating cardboard. People just do not want to eat, doesn't taste good. Shortness of breath is one of the very worrisome signs, as well as tightness, chest tightness, because you just can't get a deep breath, and muscle aches all over. So it can be headache, sore throat, shaking, chills, other things like that. CDC believes that symptoms can appear within 2 days of getting infected and can last 14 days. There are case reports of people getting it in less than 2 days. There are case reports of people having an exposure and then not getting it until a little bit longer than 14 days. But we're now aware that people can be asymptomatic or pre-symptomatic and can infect others. So asymptomatic, some people have no symptoms, but they're infected with COVID-19, and some people can infect others a couple days before then they come down with symptoms. So those two new pieces of information have been really important in all of our public health interventions. So at present, there is no drug or intervention that's been proven to be safe and effective for treating COVID-19. I think that's really, really important to emphasize, is that nothing has sustained randomized controlled trials to show that it is safe and effective to take any medicine that is really going to help more people than not and not cause any damage. So use of investigational therapies for the treatment need to be done in the context of enrollment in randomized control studies. That means that there are multiple different sites where people are doing a specific intervention, that the people, the researchers who are doing this intervention don't know what's in that little yellow pill. They don't know what's in the IV pole. It may be sugar water or a placebo. It may be the medication. It may be higher doses versus lower doses of medication. But having that be randomized, that some people get an intervention, some people don't, and then looking at the results is part of our scientific method in knowing how we can, as healthcare providers, do no harm and save the most number of lives possible. So as people are infected, as people are in different hospitals and say, well, what about this? And will this help? And will that help? Then the most important thing and the most important advice is not to just have something tried and, oh, well, let's try this or let's try that, but be enrolled in a randomized controlled study so that whatever people are trying or not trying, if they're randomized to a placebo, we then have a community population benefit from that knowledge. And it's also done in a way that is very safe. So for example, one study was just stopped very early on with hydrochloroquine and azithromycin because one of the high doses of that medication had a 35% mortality rate as compared to a 15% mortality rate of a lower dose. So we really, in everything we do in this new disease, we still need to follow all the public health and scientific methods for how we learn information and how we take care of people in our population. So the next thing I wanted to mention is that we know that about 80% of folks who have COVID-19 don't need to be hospitalized. They can take care of themselves at home. There are people that have higher risks, such as asthma, diabetes, heart disease, high blood pressure. And there also are people that appear to have no risk, who then develop worsening symptoms, especially respiratory symptoms, but it can affect all of our organs very quickly. And so that's really a scary prospect of knowing, hey, I think I have COVID-19. I'm not sick enough to be tested, maybe if there's not widespread testing in your community. But how do I know if I'm going to be this small percentage of people who need to be hospitalized? And that's why it's really important to call your healthcare provider if you develop symptoms. So first, self-isolate. If you're developing any of those symptoms, make sure you're at home, make sure that you are, you have people who are vulnerable in your home, that you're self-isolating in your room, in your bathroom, not touching everything, not going in and out of the kitchen, but people putting food at your door, but immediately calling your healthcare provider as well. We're in a new day. We don't just show up at the urgent care or show up at our doctor's office for a walk-in. We need to call. Most of the telehealth is up and running at most of our different healthcare providers, but certainly the phone has always been used in doing, night call. I've done many night calls as a physician, and we're used to getting people call and saying, this is what's going on, and working through different scenarios, especially in the middle of the night. So please, if you have any questions, if you have any symptoms, call your healthcare provider, because your provider knows you best and you know yourself best. So having that conversation between you and your healthcare provider is really important, because everyone is different and everyone's situation and those around them are different. So we know that young people tend not to have as severe effects of COVID as older people. So why are you guys important, assuming that this audience, as I know, is high school students, college students, and people in master's degree? Well, you guys are important because you literally save lives. What you do can influence whether or not someone else lives. And I'm just going to stop there for a second, because what you do and your behaviors, someone else's life is dependent on that. And that's very new for us. We know in America that all lives are interconnected, and we know that you guys are going to make big differences in the world. But literally, you going to the grocery store and coming home could save someone's life or put someone at risk. And how you go about going to the grocery store is that that factor. So one of the cases that I thought was so interesting and heartbreaking was a gentleman, and this is published in MMWR, which is a publication of the CDC. A gentleman went to a funeral. He attended a funeral, little bit of upper respiratory symptoms, and he went a couple months ago, in March, I guess we're just in April, we're almost in May, couple months ago, and attended a funeral, and then had went to the person's home, the family's home, and grieved together. And then the next day went to a family birthday party. And just those normal activities, when someone had a stuffy nose and, you know, wasn't really sick, but a little bit of symptoms, it was linked to the infection of 15 other people, whether he directly gave it or he gave it to someone who then gave it to someone else. And 3 people in those families died. So when we talk about how important it is to stay at home, how important it is social distancing, what you do saves lives. So what can you do? We talked about washing hands, not sharing personal household items, staying home if you feel sick immediately, if you're at work, if you're at school, if you're doing essential business, if you're working in the grocery store and you start to feel sick, go home immediately. Don't tough it out the rest of your shift. Go home. Avoid people who are sick, even if they're in your own household. Don't touch your mouth, your nose, your eyes. Cover your cough if you're out and throw away that Kleenex and wash your hands. And keeping yourself healthy, not just physically, but also mentally. So this slide talks about eating healthy foods and drinking lots of fluids, getting plenty of rest, but also taking care of yourself mentally. And, you know, I think this is quarantine is different for introverts. I should say quarantine and isolation they're different, but staying at home is different for introverts than extroverts. But I think anyone after 7 or 8 weeks gets a little antsy. So what can you do to stay connected to people? What can you do to keep up some of your regular habits and your exercise and healthy eating during all this is so important in keeping yourself mentally healthy as well as physically. And then cleaning those household whatever you touch. So social distancing is talked about a lot, and I put this slide in just to really go through what it means. So social distancing is a really important public health intervention. Anytime there's a contagious disease, social distancing limits contact with infected people and contaminated surfaces. We've seen just about an end of our influenza season since we started social distancing. The pediatric wards and children's hospitals are half full, not because kids are getting and not getting COVID, and not just because we've stopped elective surgeries, but all the complications of contagious diseases are gone because everyone's staying at home. So even if you go outside, which would be for essential activities, such as getting food, getting medicine, you still need to maintain that 6-foot distance, and you still need to cover your face if you leave your place. So definitely high-risk populations are recommended to stay at home. And even if you're going outside, like we said, use that face covering. It doesn't protect you from other people, but it protects other people from you. So remember, you can transmit the disease while you're asymptomatic or before you have symptoms. So this is one of those things that can save the life of someone near you, is by wearing that face covering as you're out, even as you're out on a walk, wearing that face covering and getting into that habit. The last thing I'm going to talk about is flattening the curve. And I think we've heard a whole lot about flattening the curve, why it's so important. But some people have asked really astute questions like, okay, if you flatten the curve, you're still going to have the same area under the green or bluish curve that you are in the yellow curve. So you're not changing the number of people who get this disease. And that can be right. The important thing is by flattening the curve, we're reducing the number of people who die from this disease. So all this is about is saving the most number of lives possible until we get some more information about how we can treat this disease, and until we can get some information and a vaccine that works, and until we can increase the healthcare system capacity. So you see the white dotted line across? By giving us time, by staying at home and having the NPI, the non-pharmacological intervention, we have time then to raise that healthcare system capacity. So that white dotted line, we have in San Diego a field medical center of 202 cots in a hospital system that can take overflow. We have trailers. We have hospitals that have taken their big auditoriums where all the students gather for grand rounds and turned those into hospital wards. That increases our health system capacity, as well as training up healthcare providers, bringing in newly retired providers, even if it's for virtual work, gathering more ventilators, stocking up on masks and gloves and things that we need. This gives us time with those protective measures of raising the capacity so that we never have more people with the disease than we have capacity to care for them. So that is our goal in flattening the curve. And the way to do that is all the protective measures that we've talked about. So essential services of public health, you guys know all about these, I think, because you're interested in public health, but it's really looking at all the skills that public health professionals are able to do in assessing conditions, in developing policy to protect people, and then to linking folks to services, making sure we have good workforces, and evaluating that our interventions actually helping people and producing the outcomes we want. So it's a great time to be in public health. There are a whole lot of people that are needed, and I think it's a good time for you guys to be able to see all the things that public health professionals in a career in public health does. Now, just in San Diego, I listed this slide so you can see just in our public health services, just in the county of San Diego, all the different things that public health professionals can do and contribute to. However, we have public health professionals in all areas of health and human service, from housing to child welfare, all the way through public health services. So I just wanted to share that slide for you. And with that, I am ready for questions.
Thank you so much, Dr. Tutor. We appreciate the time you took to explain some of the basic aspects of the disease that is important for all of us to understand. As you can imagine, we're fielding a number of important questions about the topic. So we already have a significant number, so we'll try to answer as many as possible. So the first one is, what should we do to be careful when ordering food from restaurants or deliveries?
Well, thank you so much for that question. That is something that I get asked every single day. I think the most important thing is trying to make sure that people who are making your food and delivering your food are practicing appropriate face covering, wearing gloves. And what I do when folks deliver is they say, oh, do you want me to ring the door and give it to you, or just ring the door and put it at your doorstep? And I say, doorstep, thank you, because you want to maintain that 6 feet of distance. That's the first thing. Everyone is a little bit different, and I think it really depends on what your household risks are. I tend to bring the food in. I wash my hands. Then after I've touched the bag, I take the food out of the bag and put it on plates, and then wash my hands again, and we all eat. Again, every household is different. There are studies that show how long this virus can live on material, but we have no information yet on whether or not that virus is transmissible for 3 days, 2 hours, or whatever it may be. So washing your hands, making sure where you're getting the food is using appropriate practices, and still maintaining that 6 feet of social distance is what's important.
Great, thank you. The other question was in relation to pets, and what can you tell us about the proper protocol for dogs or any other pets? And there was a related question from someone else about the transmission to animals. So there's been reports of big cats being testing positive and so on. So what can you tell us about transmission and so on?
So transmission, what we're learning is that some cats can get the disease. It appears not to be as severe as it is in humans, but what I've read has been respiratory illnesses in both domestic cats as well as everyone knows in New York, the tigers or lions or whatever they were, the large felines. I think that the important part is social distancing and keeping your household together. So if you're on a walk with your dog, you're not going to be letting dogs play. You're not going to be petting someone else's dog. You're just going to stick to social distancing. And social distancing means you and your household, which includes your pet, has that 6-foot bubble. There is also recommendation from the CDC. We don't have a lot of evidence, but the recommendation is if you're sick, you self-isolate, and that means keeping yourself away from your pets as well as your household members. Now, in reality, if it's just you and your cat, that's going to be a little harder to do, but that is the recommendation. Do we have a whole lot of science or data on that yet? No. These are our presumptions, and as we extrapolate what we've learned from other diseases.
Great. So one of the questions is about what should we be eating? You know, your slide talked about food, and what should be eating to improve immunity and strengthen our immune system?
So I'm pretty big on eating a plate full of lots of different colors. And we don't have any new information of, oh, this is, you know, taking this many oranges a day or having this vitamin is going to protect you. There is no information, no FDA studies, nothing that shows that any specific intervention is going to reduce our risk, reduce the severity, or even prevent us from getting COVID. So all the normal things apply, and it is eating fruits and vegetables and healthy food, plenty of fluids, like we always recommend 8 glasses of water or fluids a day. We don't have any panacea. So doing your normal healthy routine is what's really important, but no vitamins or, you know, don't buy something on TV, but wait, you can get more for $19.99. None of that has been proven. And there are a lot of people out there trying to sell different things, but we don't have any specific information. So do what we already know is important for nutrition, and that's getting your fruits and vegetables, getting your sleep, getting fluids, and you know, that's our norm.
Yeah, wonderful. So a lot of questions are coming in about specific professions: dentists, massage therapists, acupuncturists, doulas in hospitals. And what can they do to protect themselves if they are being sent back to work, if they are being told to go back to work? What can they do in these types of professions where social distancing is really very difficult?
That's a great question, and we really continue to get more and more questions like that and try to include more and more information as we are very rapidly studying our healthcare workers to see what the incidence and prevalence of getting COVID is in different workplace situations. And so I always rely on CDC. It has recommendations for healthcare professionals. First of all, anything that is not an essential medical, dental, mental health in-person visit should not be done in person. And so if you have a toothache and it's an urgent need, then you go to the dentist and you call your dentist, and your dentist will ask you what kind of symptoms you have, what's going on with you. And you can ask your dentist, so tell me, what kind of precautions are you all taking? The important thing is that folks should be wearing eye protection. Folks should be wearing at least a mask in the healthcare professional, not a face covering, but a mask. Depending on the procedure, it might be an N95 respirator if they're aerosolized, containing particles induced by the procedure, or a regular surgical face mask if not. But the eye protection, the gloves, the face mask, and then a gown is the norm of that protection for healthcare workers. But A massage parlor shouldn't be open. It's not essential. Any of those non-essential, say talking to your your mental health provider, that doesn't have to be in person. Anything that you can do telephonically, you should. And all of those requirements of having ultra secure and only certain types of phone calls and things like that, those have all been relaxed to allow people and their healthcare provider to communicate. Obviously, a doula, you can do some things over the phone, but some things you can't. And so I have a friend, I was just talking to her, she's 33 weeks pregnant. And I was talking to her yesterday. Well, she's going to be working with her doula over the phone as she goes into early labor. Obviously, she's going to go into the hospital to deliver, but working things through. And so there's no one answer for all of that. But I think the important part is going to the CDC website and seeing what's recommended, talking to your healthcare provider, or if you are the healthcare provider, talking to your facility or place of work and ensuring that you're meeting those CDC recommendations, and then talking to your patient, your client, or your healthcare provider, and making sure that you are both comfortable and aware of, before you go in person, of what each other is going to do to protect each other. That communication is so essential.
Thank you. So we have a couple people asking the same question. Does hand sanitizers kill COVID-19?
Great question. What we think is yes. And we think that as long as it is a 60% alcohol-based hand sanitizer, we still recommend washing your hands when it is possible. So washing your hands and singing the happy birthday song twice. And if you haven't done that, it's a really long time. We recommend 20 seconds of hand washing. I never thought like singing happy birthday was 10 seconds, but apparently it is. So sing happy birthday twice, wash your hands with soap and water when you can. If you can't, then use hand sanitizer, but make sure it is at least 60% alcohol based. And you want to use your hand sanitizer until it dries.
Great. So we have some questions about still, you were talking about mental health and the need to maintain some aspects, and going out for walks in our neighborhoods is one way people have been using this time and in those circumstances, they're asking, should we be wearing a mask when we're jogging and walking, even if we're 6 feet apart from anyone while we're doing it?
Yes. And here's the reason. One, if you leave your place, cover your face, you're going to protect someone else. Two, you never know when someone is going to be coming around the corner or headed towards you. You can probably see, but what if they're passing you from behind? You don't know. And so my recommendation and the CDC's recommendation is, if you leave your place, cover your face, wear that mask. It's not very comfortable. It saves a life. So what a small price to save a life. You don't know when you're infectious, because it could be before you have symptoms. So always in the habit, cover your face wherever you go. I don't wear one when I'm in my car, but I have one and I put it on before I get out of my car. I put it on before I leave my house. And the other thing is, folks, you are setting a good example for others. So if you as young people go out with your face covered, someone else is going to be looking at you and saying, man, I really should be wearing a mask. Isn't it great that these people are protecting my life by wearing a mask? It's a little bit of uncomfortableness to really save a lot of people.
We have California specific questions. What do you feel about the reopening of our beaches and our parks?
Oh, that is a California specific question. The governor has listed the governor of California has listed specific data metrics that we need to accomplish before we very slowly start opening up our public areas. And so I think it is wonderful to use data to inform our decisions, and very important to watch what happens as we very, very slowly open up those regulations. And if the data shows that more people are getting COVID and we have a higher incidence and more people are in the hospital and we're approaching that line of what our health capacity is, we need to dial back. So I think like anything, you make anything scientific, you have your assumption or your hypothesis, you know what your data points are, you make a change and you see if that intervention is safe or not safe or leading to the expectations that you have. I'm in San Diego, we're right on the border. And so one of the things that we have really noticed is all of those predictive modeling anticipations about what's going to happen in your county and, oh, you and your county will be fine. It just looks at you and your county. That's not how the world works. We have a county to our east who has only 2 hospitals. We have the border of Mexico to our south, which is having a huge outbreak right now, especially in our migrant shelters. And so we can't live in isolation and look at public health in isolation. So that's why I think it's very important to follow the data. We have great examples of the 1918 flu epidemic. And I think it's very important to learn from history and to move very slowly to see what we can do to protect the population. That balance, of course, is saving lives and saving the economy, and what happens when people are out of jobs and don't have food and don't have the mental health support and are sequestered at home. And so it's a very challenging time to balance both of those, because everyone wants to keep people safe and healthy. And how do we do that is the really tough question. So I think any changes have to be small, they have to be measured, and we have to constantly analyze what the effects of that are to ensure that we're doing the right thing.
Great. So I have questions which relate a lot to your work experience with community clinics. So give us insight on people who do not have healthcare insurance at the moment. So they won't have a PCP, obviously. They usually consult ERs when they have a major health concern. What is a way to get them tested if they start to experience symptoms? And how do they get themselves to hospitals if need be?
Those are great questions. So traditionally in San Diego, before the ACA, the Affordable Care Act, our community health centers, otherwise known as federally qualified health centers, have money and have funds from the federal government through the state to serve underserved populations. It may be people with Medicaid, it may be people who are undocumented, it may be people with no health insurance. And until that ACA, most of our adults in California, unless they had young children, did not have health insurance. And so people would come into the community health centers. There would be a requested amount, maybe $20 as a down payment or deposit, but certainly on a sliding scale and certainly according to what people could afford. And then that would cover their primary care. There's dental at community health centers, mental health, all kinds of services that serve as someone's primary care provider. I mean, I was caring for, families, and it was wonderful. Some had insurance, some didn't. With Affordable Care Act passing then, and how California managed it, is that we expanded our Medi-Cal population. California calls it Medi-Cal instead of Medicaid, and most people were insured. And so either through the ACA or through Medi-Cal. And so people were insured. They would still come to community health centers for their medical care, but say they had Medicaid, say they had a PPO, and the community health centers are in people's neighborhoods, speak the right language, we understand the culture. Our workers, people who are in our community, are the people who work and who take care of our neighborhoods, our population. And so as a white non-native Spanish speaker, I learned so much from my colleagues and my nurses and my receptionists at the community health center to really learn how to best care for that population by listening. Right now, we have expanded in California that ability to sign up for Medi-Cal, to sign up for food stamps called CalFresh, and to sign up for the Affordable Care Act, to sign up for those services. So we have an influx of more people needing all of that public health assistance. And that is really important for us because we've done a number of studies in San Diego, and uninsured people don't just go to the emergency room. We have folks directed and available for their primary care and for their urgent care appointments at community health centers. So we really avoid that going to the emergency room to seek primary care. And it's been a huge collaborative public effort for at least 10 years here in San Diego. A lot of patient education, but really beefing up the services and the hours and the times are needed as we listen to our community of why do they go to the emergency room as opposed to coming to their neighborhood community clinic. With COVID-19, it's the exact same thing. And with the exception that we ask everyone to call first. So if someone doesn't have a primary care provider, if we ask them first, do you have insurance? And if they have insurance, you'll look on the back of your card, see what number you need to call. And if you don't know who your provider is, you call your health insurance, even if it's Medi-Cal, talk to customer service, and they say, oh, here's your provider, or let me help you find a provider in network that you can go to. If people don't have insurance, we have something called 211, which is nationwide, but we have a really expansive 211, which is our community information. And you call 211 and talk to someone, a real live person, and they can help you find the appropriate community health center closest to you. They help you apply for Medi-Cal, and our community health centers have first visits for new patients that are telehealth. And we've been really working very hard in the last 4 weeks to ensure that all of our community clinics have that up and running, that they're able to get payment for that first visit, even if it's not in person. And so for us, if you have no insurance, you call 211. If you have insurance but not a healthcare provider, then you look on the back of your card, because we want people to go in network so that they don't have any out-of-pocket expenses. We want them to understand and have that connection with their primary provider. Did that answer that question?
Yes. One quick follow-up. If any of us get symptoms that we think require hospitalization, or we're told when we call our primary that it needs hospitalization, do we drive ourselves or do we call an ambulance?
That's a great question. If your provider tells you you need to go to the hospital now, that's a discussion to have with your healthcare provider of, do you need to go by ambulance because you need the medics to come to you right away and give you oxygen? Are you by yourself, and are we worried about you having more symptoms and not be able to drive safely? Or are we thinking, you know, my office is closed right now. There's no urgent cares closed, and it just doesn't sound right. Why don't you have someone drive you to the hospital within the next hour? So all of that depends. However, the most important thing is someone needs to call the hospital, whether it's your provider, whether it's the ambulance, or whether it's whoever's driving you, and say, I'm coming in. My doctor told me to come because I have COVID symptoms. Because the hospital, then before you ever get there, in San Diego, we've worked out dispatch processes when you call 911 and all other processes. The hospital prepares a room that's negative pressure. The hospital ensures that everyone's masked and gowned and all ready to take care of you as you arrive.
Great. So after we answered the question about wearing masks, we got a bunch of additional questions on specifically, can you tell us what type of masks work best, the differences in effectiveness in the type of masks that should be worn for individuals outside? Cloth masks, surgical masks, N95s, that kind of thing.
Got it. If you are not a healthcare provider, you should not be wearing an N95. If you are not a healthcare provider, unless your doctor tells you for some reason you should be wearing a surgical mask, you should not be wearing a surgical mask. All of us, as we're going outside on our walks, as we have to go outside to the pharmacy or a grocery store if we can't have things delivered, we should be wearing cloth masks. And the reason is we're in a shortage of medical masks. We're in a shortage of surgical and N95 masks. We should not be taking those away from our healthcare providers who are much more at risk on the front lines. So a cloth mask. And the CDC has great information on what a cloth mask can look like. A lot of people are using flannel because what the CDC says is if you can't see through your fabric, that is more protective. Again, you're trying to prevent you giving someone else a virus, which is why when you see people walking around, if they're not wearing a mask, they're hurting you.
Thank you. So one of the questions is about how long do we think this social isolation process is going to be? And I know that's a hard question, so I'll open it. I'll just let you answer it in the best way you can.
I love it. You can even say it without a smile, right?
Yeah.
And I wish we all knew. I really wish we knew it. That goes along with the question of, do we think we're going to see this start to decrease because it's warmer outside? Do we think we're going to get a heavier influx of COVID-19 this fall and winter with the flu season? Is this going to go away? Is it going to come up and down? Is it going to stay? Is it going to get worse? Is it going to go away like SARS did? I'm sorry, like MERS did, or is it going to stay? We don't know. And so I think that is the really, really challenging part. And it's very overwhelming. And even looking at all the literature from yesterday to this morning, trying to make sure I had the latest answers for you all and the latest research that was published in the last day or two, it's very overwhelming the amount of information we're getting, and yet the lack of clarity on what this is going to be like. And so I think for me, that means taking it one day at a time. And for you guys, you don't know what's your school going to look like right now. Probably all of your graduations have been canceled, which is really difficult. We don't know what the summer is going to look like. Are you going to have summer school? Are you not? Are we continuing with this virtual school? You don't know what work's going to look like. People don't know if they're going to have jobs or not have jobs. And that is incredibly difficult, not at all to minimize that. So there are more and more resources on how to deal with this mental uncertainty. And that's really what it is how do we deal with uncertainty? We don't know what's going to happen and how much is in our control and isn't. And that's why I'm focusing on what we can do to help others, and not just by wearing masks and staying home, but what does your neighbor need who might be older and they're not able to go out? What can you drop off at home? What can you do for healthcare workers who might be on the front line? What about people who through your church or temple or mosque are homebound and not able to really have their social outlet? Can you call them? Is there a list of people who have chronic diseases who are getting home food delivery, but people can't go inside and chat with folks every day? So what kind of work can you do to stay connected and help others? And we have so much uncertainty that instead of focusing on that, one of the things I try to do is, what can I do today? And with my team, we're in the Emergency Operations Center in San Diego. And we've been doing this almost 8 weeks now, 24/7. And people are working 100 hours of overtime every 2 weeks. I mean, it's really incredible. And so what I'm trying to help my team and me do, because they help me as much as, I say things to them, is what's our goal for today? Just narrow it down. What are we going to try to do today? And if that's call someone who might be lonely, it's going to help us just as much. If that is staying home and instead of going to the grocery store 3 times this week, I'm just going to go once a week. If it's texting someone, hey, I'm going to go get some more toilet paper, need anything? All of those things I think are so important. And there are volunteer activities that you can do from home. Even writing cards and thank you notes. I had a friend who's usually a hospice nurse and has been pulled into doing intakes. And he doesn't have that connection anymore with all of his families. And he really misses that. Wow, am I doing something that's important when I'm just doing these intakes? And his boyfriend said, can someone please send him some cards? Because that's how he's going to feel better on that connection. So I really do think what inspires me is what all my colleagues are doing, what my teammates are doing, and how this whole community is coming together Hospitals are helping each other. Oh, you don't have the testing? Let me do that for you. Oh, you need some of these ventilators. I want to see how you're doing so I can prepare in advance when I'm going to need to lend you some ventilators. How can we work in that community of that here and now? Because we don't know the future. And for me, that works much better in how I can help, I can contribute, and I can stay a little sane. So I don't know if that answered your question, but transparently for me, my team asks me every day, hey, Dr. Tudor, did you get a shower in today? I'm like, yes. And they're like, okay, we know that's self-care. So it really doesn't matter what that self-care is. I did take a shower today, by the way. But it really is that and connecting with others.
Okay. So we have a question on what policy or health system responses have been particularly effective internationally. Are there any countries or regions that you think are doing a good job in containment and prevention?
That's a great question. One of the early countries we modeled ourselves after was Singapore. And you can definitely see on the Johns Hopkins website how different graphs of different countries as far as the number of cases and the number of deaths have gone up or have stayed very steady. One country right now in the news is New Zealand, with only 1 death and 4 new cases this weekend. And they're an island. It's a little bit easier, as they say, for controlling who's coming in and who's leaving. But definitely those countries that have more testing, that have all of the non-pharmacologic interventions, which are stay at home, cover your face, keep 6 feet of distance when you have to go out, and using the data to show when it is appropriate to start relaxing some of those care conditions as population. And it's a paradigm shift where it's caring for the population. It's not, what do I need for me? It's not comfortable to wear a mask. So what? It helps save lives. And that's a really different shift for us in the United States.
So are there reports of reinfection? Can an individual get the virus multiple times?
Great question. And I do want to emphasize, besides us not having any interventions that have been shown to help and not hurt people, the antibody tests that we have are not 100% accurate. Only 7 are approved by the FDA, and that's just under emergency use authorization. And even those we don't know how to interpret. So the antibody test and different pop-up testing sites, don't use those unless you've talked to your doctor. The antibody test, one, if they do show that you have antibodies, we're not so sure it's to this SARS-2, the coronavirus that we're looking at. If you do have antibodies, we don't know if that means that you are protected against another infection. And if you do have antibodies, we don't know that that means, are you no longer able to transmit the virus to others or not? So even if you get the antibody test, we don't know how to interpret it. We don't know what it means. We are seeing in South Korea that people that have had a positive test have then tested negative, and this is all the PCR tests, the nasal swab test. They've tested negative. They've started to get more symptoms. They test them again and they're positive. We don't know if that means that they're going to get full-blown symptoms again. We don't know if that means that that test being positive means that they're just carriers, or can they actually transmit it to someone? There's so much we don't know. I think a lot of you are going to be the scientists that help give us the answers.
Thank you so much. We had so many more questions that we didn't get to, but I want to take the time to thank you for sharing your expertise with all of us, and for all of our participants sending their thoughtful questions and their attention. A recording of this webinar will be available online on the ASPPH website soon. And as you close out of this session, you will notice that you have a survey pop-ups. Please take a brief moment to do the survey so we have better information for the future. And finally, on the next slide, we have upcoming sessions for our virtual annual meeting, and you can learn more about these on the ASPPH website. This concludes our webinar. Thank you all for joining us, and thank you, Dr. Tudor, for your time.
Thank you. Stay safe, everyone. Thank you so much. You're our future.